Central venous access devices, or ports, are common among individuals with MPS disorders. Our children and adults with MPS who are receiving enzyme replacement therapies often are receiving those therapies either weekly or every other week, and they may often decide to have a central venous access device or a port placed to make the infusion day itself more streamlined and straightforward, as well as reducing the trauma associated with repeated IV sticks. So a central venous access device or a port is an indwelling catheter that lives just under the skin, typically in the chest somewhere, that can be easily accessed with a needle from the outside. There's a tunneled catheter that goes into the blood vessels and then delivers that enzyme replacement or the therapy that we're delivering. The trade-off of having a foreign device living inside the body is that there is risk of infection associated with that. There's a couple of signs and symptoms that make us worried about a port infection. Of course, there's obvious things like swelling, redness, tenderness, or drainage from the port site itself, but there can be far more subtle signs of a port infection. So really, anytime a child or an adult who has a port has a fever that we can't explain, we think about whether there might be a port infection. Other symptoms such as vomiting may be an early initial sign of port infection. So anybody who has a port, it's really important that they touch base early with their provider if they have any concerns about an infection in that device.